Hello everyone and welcome to another video. In this video, I'm going to cover the introduction for pneumonia. So when we breathe air, it moves to the trachea, which is this part over here. So this is the trachea. And then from the trachea moves into the bronchi. So it's this tubes over here. So this is the bronchi. And then from this large tube, it moves into a smaller tube, which is these over here. And these are called the bronchioles. And from the bronchioles moves into the air sacs, which are these blue ones. And they're called alveoli. So let's look into this alveoli. So let's take one and make it large in size. So here is an alveoli. These alveoli, what they do is that they're very flexible. So they help in when we inhale oxygen, they basically expand and they become larger. And they do the opposite when we exhale carbon dioxide. So what they do is that so here is an alveoli. It becomes larger in size because all the oxygen it's coming inside it and getting ready for exchange of oxygen with carbon dioxide with the capillaries around these. So in this case, what happened, they inflate just like a balloon would when putting air inside it. So here would inflate versus when we exhale, what happened, these alveoli, they become smaller in size. And this is because CO2, carbon dioxide, is basically leaving the body. And in this case, we deflate. And the way the alveoli does this is basically through the capillaries, which is a blood vessel surrounding these alveoli. So here is an alveoli, and surrounding all these alveoli in the lung, there are blood vessels around them. So this is like a blood vessel, and inside this blood vessels there is blood and carbon dioxide, CO2. So what happened is that this CO2 would leave the capillaries and moves inside the alveoli, and the opposite would happen to the oxygen, O2, inside these alveoli. It would leave the alveoli and come inside the capillaries. So this is the capillaries. So this is what happened in normal condition where we're breathing. When there is no pneumonia, nothing is going on. When pneumonia happens, which can happen to two different germs. For example, it can happen to first bacteria, second viruses, third fungi. So what happened when these germs comes through the inhalation system, they pass through the trachea, bronchi, bronchioles, all the way to the alveoli, leading to the inflammation of these alveoli, which leads to the inflammation of the lung. This is why when a person or an individual have pneumonia, they have difficulty breathing. They feel they're having not enough oxygen in the body. So in this case, what happened is that the body tried to defend itself to protect that individual from getting sick. And the way it does that, it's through the mucus that is available through these tubes. So let's look into the cells in these tubes. So let's say these are cells lining these tubes. And on top of these cells, there is a hair-like cilia. So this is hair-like cilia. So what this cilia does is basically moves the mucus that is on top of it with the germs that are captured by this mucus, because the mucus is very thick. So when a germ comes by it and touch it, it sticks to it and it moves with it. So let's say these red ones, they're basically the germs. So as these cilia move, they move in the mucus and the germs, and a person gets it out of the body through coughing. So this is one of the ways that the body protects itself from getting sick. The other way, which let's say that these germs make it all the way through the alveoli, trachea, bronchi, bronchioles, and then alveoli. So let's say that we have this alveoli, and these germs comes all the way inside. So what they start doing, they're gonna start multiplying. It's a germ, it's gonna start multiplying to live. And what the body is going to do, it's gonna respond to this by the immune system. So the immune system will start fighting these germs and trying to eliminate them to prevent that person from getting sick. And what happened is that for those people who are ill, fatigue, or their immune system is compromised, or their immune system is not as strong as it used to be, what happened is that the multiplication of these germs, it's going to overwhelm the immune system, leading to inflammation of this alveoli. And once we have an inflammation, a fluid starts in these alveoli. So from this state, it's going to move to this one. So here, we're going to have an alveoli that is full of these germs, in addition to fluid inside it, which makes it really hard when a person is trying to breathe and supply the demand oxygen to the body. And this is the reason why when a person has pneumonia, there isn't enough oxygen in the body. And this concludes this video. If you have any question, please leave them in the comments below, and thank you for watching.